Good afternoon, everyone. I think I'm going to make a start. I recognise that people are still joining and that Janice and Rhian will continue to admit people through the lobby onto this session. But I'm conscious at how tight we are for time, so I want to use all of our available time this afternoon. So good afternoon and welcome. My name's Mae Thomas. I'm the Deputy Police and Crime Commissioner for Gwent, and I'm delighted to chair this session today. Today, as we are all aware, is Elder Abuse Awareness Day, and I'm delighted to see so many professionals and partners, practitioners, colleagues here today at this session, which aims to provide you with important information in terms of your roles, and to particularly look at how we in Gwent, partners across Gwent, are working together to protect and promote and safeguard older people in our communities. Abuse really does not have any age limit, and this session will shine a light on some of the things that you are aware of, but hopefully provide new information which will help to support older people in our communities. I'm also pleased to say that the Older Persons Commissioner for Wales, Helena Herclots, has released a report on support services for older people experiencing abuse today. And she has welcomed the fact that we are taking the time together today to really consider our work and how we can improve our services to older people. It falls to me to give you a few of the housekeeping arrangements before I pass you over to Jeff Cuthbert, our Police and Crime Commissioner for Gwent. This session is now being recorded, and it will be posted on the Gwent PCC YouTube channel for anybody who is unable to join to be able to view the session at a later date. If you have any objections to recording or any photos being taken, please let us know through the chat. And in particular, please make sure that you switch your camera off. We would appreciate, depending on your bandwidth, if cameras can be turned off during the session, which will allow us to focus on our presenters and hopefully maintain our connectivity. And can I thank all of our presenters for their time and commitment today. We have a very tight agenda, so I'm going to keep us moving through our contributors today. If people can use the chat function to pose any comments or questions, we've really focused our agenda today on being able to hear from as many presenters as we possibly can. And if there are any questions that you wish to be posing, if you post them through the chat, and then if time permits, we will try and have and address those questions throughout the presentations. I'm aware that people have got other meetings beginning at 2 o'clock, so we're delighted that so many people have been able to attend with us today. We're on 98 participants. That is fantastic, and it really outlines the commitment that we have in Gwent to protecting older people, to working together, working in partnership, and to tackle the abuse of older people. Can I hand us over now to our Police and Crime Commissioner, Jeff Cuthbert.
Thank you, Larry, very much for that welcome. And I too am absolutely delighted to see so many people here today. I was very pleased just 1 month ago to be re-elected for a further term, 3 years in this case, as the Police and Crime Commissioner for Gwent, and I'm equally delighted to say that I was able to reappoint Larry Thomas as the Deputy Police and Crime Commissioner for Gwent. That was achieved with unanimous support from the Police and Crime panel, and I'm very grateful to them for that support. So, just a few remarks. The Chief Constable and I are delighted to see so many people have joined this session today to raise awareness of the impact and effects of elder abuse. This session aims to shine a light on the signs of abuse and to hear from organisations that put the protection of older people at the forefront of their work. Supporting vulnerable people and victims is at the heart of my police and crime plan for Gwent. Abuse of any kind will not be tolerated. I have seen the devastating and life-changing events that abuse has on victims. I'm pleased to be able to provide funding for organisations such as Connect Gwent, our multi-agency hub for victims and witnesses of crime and antisocial behaviour and abuse. I'm pleased to see Jane Hunt from Age Cymru. Jane is based in Connect Gwent and offers unique help and support to older people. My office also provides important funding to local organisations that offer support to victims of domestic abuse. Phoenix Domestic Abuse Services, Cynnal and New Pathways are lifelines for victims of domestic abuse in Gwent. Sadly, we know that older people are particularly vulnerable to abuse and exploitation, and evidence has suggested that the pandemic increased isolation and therefore vulnerability. There will always be people, sadly, who seek to exploit the vulnerable, so it has never been more important for people to recognise signs of abuse. I am delighted that this event has been endorsed by the Older People's Commissioner for Wales, Helena Hairclots, and she has provided the following statement. World Elder Abuse Awareness Day is an important reminder of the particular ways that abuse may affect older people and the devastating impact this can have on their lives. So I'm really pleased that the Police and Crime Commissioner for Gwent is bringing together key partners to explore the initiatives underway locally and nationally to protect and safeguard older people and to examine ways of working together to ensure that older people experiencing abuse or at risk of abuse can get the help and support that they may need. Now, abuse, as we know, is a very sensitive subject for anyone, but even more so for our older communities. It is brave for anyone to speak out. The pandemic has shown us all that kindness and understanding can have a huge impact on someone's life. Being aware of the signs of abuse whilst working in communities could help someone who is being abused or in an abusive relationship to get the help that they need. I hope that this session provides you with an opportunity to reflect on how you have helped and could help others in the future. I look forward, as I'm sure you do, to hearing from all the presenters today. And I hope that we have an excellent, informative and educational morning. Thank you very much.
Thank you, Commissioner. And can I hand over now straight away to Kerry Wood and Louisa Batten from the Gwent Safeguarding Board. Kerry and Louisa, over to you.
Thank you, O'Leary. I think it's just me you have, though. I think Kerry is here. I'm just going to attempt to share my screen so I can share the presentation. Can I just check you can see that?
That's great. Thank you, Louisa.
Brilliant. Thanks. So thank you, O'Leary. My name's Louisa Batten. I'm an adult safeguarding coordinator. I work for Caerphilly County Borough Council's adult safeguarding team, and I've been asked by Kerry and the Gwent Safeguarding Board to spend some time today with you looking at the types of abuse we are seeing in adult safeguarding, to look at some of the indicators and signs of abuse, and also to highlight the reporting pathway. So these types of abuse you can see on screen now, I'm sure are familiar to all of you, and we do see all of these types of abuse being reported to us in adult safeguarding teams. In terms of physical abuse, what we know is that physical abuse is any type of physical harm. Physical suffering includes things such as hitting, kicking, shaking, misuse of medication and restraint. And sadly, we do see these things being reported to us. Sexual abuse includes forcing or enticing an adult to take part in sexual activities, and these can be contact and non-contact activities, and also includes other types of sexual abuse, such as the use of pornography and photographic images. When we see emotional abuse as a separate category, we think of emotional abuse as that bullying behaviour, those threats of harm, threats of abandonment, coercive control and humiliation. But I think we all acknowledge that if you were abused in any of the ways you can see there would always be an emotional impact. But when we see emotional as a separate category, we do think about those threats, that bullying type of behaviour. In terms of neglect, neglect can be the failure to meet that person's basic needs, to provide care, to assess and manage risk, and it includes intentional and non-intentional acts and omissions. And likewise with self-neglect, we're talking about the same negligent type of behaviour. However, with self-neglect, it's often the person themselves that are lacking in providing themselves with self-care, which can often then result in, threatening their health and safety and their general well-being. And finally, on that wheel, financial abuse. Financial abuse can include theft and fraud, scamming and doorstep crime. We've also seen cases where older people are being pressured to change their wills or restricting access to money, sextortion and other types of financial abuse. I've been in the team for 12 years, and for 12 years we are seeing all of these types of abuse being reported to us. We do also, however, deal and manage other types of abuse, as you can see on the screen there. These things do happen in Gwent. I think from my years of training, people will often say to me, oh, human trafficking doesn't really happen in Cyffili, or modern day slavery doesn't really happen, when sadly it does happen. We do regularly receive duty to report forms, which include some of the things you can see there on screen. When I think about my observations of the cases I deal with and older people, my observation is that it's often domestic abuse or exploitation, financial exploitation, rather than the others. And when we think about domestic abuse and VAWDA SV, the acronym there, which is Violence Against Women, Domestic Abuse and Sexual Violence, we have a UK-wide government definition, which is domestic abuse, and VAWDA SV is any incident or pattern of incidents of controlling, coercive or threatening behaviour, violence or abuse between those aged 16 or over who are or have been intimate partners or family members, regardless of gender or sexuality. So historically, domestic abuse was often seen as a intimate partner relationship issue, but since we've had this UK definition, there is more acknowledgement that actually domestic abuse happens within family members as well, sisters, brothers, mothers, daughters, etc. And you can see there that it states that it includes, but it's not limited to, coercively controlling behaviour, emotional and psychological abuse, physical abuse, sexual abuse, financial abuse and harassment and stalking. So very similar to those types of abuse I've just taken you through. And when we identify through the reporting process that a concern may be domestic abuse or VAWDA SV, then we have an additional referral pathway to seek specialist support and services for the people we're trying to protect and safeguard. In terms of the indicators of abuse and signs of abuse, I could probably spend hours talking you through some of the signs of abuse across all the different categories we've just spoken about. However, I'm going to focus on neglect and financial abuse, again, because of my own observation that these are particularly prevalent with older people. And when I've spoken to report makers, what they tell me is some of the signs or some of the concerns they've had, which has triggered a report, has included things such as poor living conditions, so unsanitary, squalid conditions where there's evidence of hoarding. There might be lack of food in the property, lack of warmth, even lack of hot running water that carers may need to provide care. The older person may present with pressure sores or other poorly managed health conditions. There may be medication errors or medication errors, being given the wrong medication at the wrong time. They often see that medical emergencies are not responded to or medical appointments are not being kept. There may be a failure to risk assess the situation and manage that risk. We may see frequent 999 calls by the older person or frequent wandering episodes. Also, we see concerns such as significant weight loss or falls. And these are the type of things that are triggering professionals to actually think, is there a bigger picture here? Is this person being neglected? Are they being abused? Do we need to seek support? When it comes to financial abuse, again, speaking to those report makers about what made them question or what made them concerned to begin with, it was seeing that utility bills had not been paid. You know, people were being cut off from their electric and gas. There was mounting debt, rent arrears and eviction notice were being served. Unexplained withdrawals from their bank account. So an example is an older person receives her monthly bank statement and sees various withdrawals at cash points or online transactions where they don't actually use online banking. Some reports around pressure to change wills or to actually release equity from their property. We've often have reports of possessions being missing, so items of value such as money or jewellery or other things missing from the property. We often as well see situations where the older person chooses to cancel a package of care, citing that they can't afford to pay the care fees. And also lack of food, lack of possessions. You know, I've even come across situations where an older person doesn't even have a bed to sleep in. And again, you know, this situations where they're being restricted access to their money. It might be that they have somebody who manages their money on their behalf and in doing so restricts them, may only give them £5 or £10 a week. So I just wanted to spend a little bit of time, because that is my own observation of the types of referrals we receive for older people, is that of late it seems to have centred around neglect and financial abuse. And these are some of the things that might indicate an abusive situation is occurring. So when we identify concerns as practitioners or people working with older adults or adults generally, we need to look at whether they fit this definition of an adult at risk. An adult at risk is a definition that came from the Social Services and Wellbeing Act for Wales in 2014, and it has three parts to this definition. The first one is, are they experiencing or at risk of abuse or neglect? So they don't actually have to be abused or neglected to fit this criteria. The risk being there is enough to satisfy that first part. The second part of the criteria is, do they have needs for care and support? And again, it's irrelevant whether the local authority are meeting these needs. If they have the need for care, if they have the need for support, that second part of the criteria is met. And then the third part, it says, as a result of these needs, they're unable to protect themselves against the abuse or neglect or the risk of it. So if you are working with somebody or you're aware of somebody and feel those 3 points are met, then you've got a reasonable grounds to suspect they're an adult at risk. And in doing so, there is an expectation that that is reported to the local authority. So what is the duty to report pathway? There is a statutory duty on relevant partners of the Adult Safeguarding Board to make reports, and there are certain safeguarding steps we encourage practitioners to take. From the moment you have your concern, or from the moment you are concerned that an adult is an adult at risk, we do expect that a report is submitted to the local authority within 24 hours. However, there are certain things you may wish to do within that 24 hours. So the first thing is, if you feel somebody is in an immediate urgent risk, there's a dangerous situation, then we encourage you to call 999. Within each of your own organisations, whether you work for the health board, a voluntary organisation, the local authority health, there should be a DSP, which is a designated safeguarding person, somebody you can ring, somebody you can have a conversation with and tell them what's happening and tell them what action you're taking. If the situation isn't so serious and immediate that you need to call 999, we encourage you to speak with your DSP as soon as possible. Within the same day, have a conversation with them about your concerns, tell them what you've observed, tell them why you feel that person's at risk, and then between you and the local authority, a decision will be made about whether you submit a report. Once the decision is made for that report, we do expect it to be completed. It's a sort of Microsoft Word document and is submitted to the front door of the local authority. Those departments are now called Information Advice and Assistance. We then, as in the local authority adult safeguarding teams and front door services, start utilising the Wales safeguarding procedures to decide how we're going to respond to that concern. What are we going to do to safeguard them? How are we going to protect them? And we start making inquiries. Now, the Wales safeguarding procedures from 2019 are a new set of procedures that incorporate adult safeguarding and child safeguarding. So it's one set of safeguarding procedures to protect people. They're not available as a paper copy. They're only available online or through downloading an app. The app can be downloaded to a smartphone or a smart tablet. It doesn't cost anything to download it, and once it's on your device, there is no data required to use it. It is a really, really easy, friendly user type of set of procedures. When they were being designed, the intention was that you will be able to find what you're looking for within 2 clicks. There's also a search bar. So, for example, if you're looking for something on child sexual exploitation, you would type that into the search bar and then it would take you to every single reference to child sexual exploitation in the procedures. If you haven't already downloaded it, please download it. Please have a look at it. It's got lots and lots of information on it, and it will be an ever evolving set of procedures. So as new legislation comes out or new updates are made, then the procedures are also updated. Within the procedures as well, you will also find reference to the regional safeguarding boards. As you can see on screen now, it's highlighted there where the Gwent Safeguarding Board website is. But if you're from the other safeguarding board areas, you will also be able to access their board websites from the procedures. When you arrive on the Gwent safeguarding page, the page is divided into 3 main themes. One is safeguarding children, one is safeguarding adults, and one is the violence against women, domestic abuse and sexual violence. Please visit this website if you when you have a moment. Again, it's got a wealth of information on there, from learning resources, video clips. There's a host of training you can access from the Gwent Safeguarding Board. And you'll also find the duty to report form for reporting concerns. So whether you work in Terfyn or Blaen y Gwent, you will find the form there, you will find the telephone numbers, you'll find the email addresses, everything you need to actually make a report to the local authority. And finally, my last slide, we just wish to draw your attention to some new publications. So the Gwent Safeguarding Board has recently published the Adult Safeguarding Guidance. It's called To Report or Not to Report. It takes you through how we in Gwent apply the Wales Safeguarding procedures and some of the thresholds we look at when deciding how we're going to respond, what inquiries we're going to make and how we're going to safeguard people. And the second is a financial abuse document leaflet, which has been put together to try and keep ourselves safe from being a victim of financial abuse. So it's a really good tool to use for yourself in terms of trying to prevent financial abuse and keeping yourself safe online. But it's also a really good resource to use with people to try and prevent them from also being a victim of financial abuse. So thank you very much. I'll try and exit this now and share my screen.
Thank you, Louisa. Really important context and information to start this session. And to remind us of the important aspects of abuse. I want to hand over now to Rachel Nicholson, the Director of Hourglass Cymru, for an input. Hourglass Cymru is the national charity dedicated to calling time on the harm and abuse of older people. If I can hand over to you, Rachel.
Thank you, Larry. I will share my screen and hopefully this will work well. Is that all working? Brilliant.
Looking good.
Thank you so much. And it's really great to see so many people here, over 100 people here for an event marking World Elder Abuse Awareness Day. And thank you to the Commissioner for inviting us here. My name is Rachel Nicholson. I'm the Director of Hourglass Cymru and the Director of Performance and Partnerships for Hourglass UK. So we are Hourglass, formerly known as Action on Elder Abuse. We have been working to protect older people for nearly 30 years. And we do this via campaigning, lobbying, providing awareness sessions, training, conferences, and supporting older people directly and those concerned about an older person through our helpline and information services. So today I'm just going to give you a brief overview of what abuse looks like in Wales. It's very hard to know how many older people are experiencing abuse in Wales. The data is not collected, but we did some polling last year, which revealed that 1 in 5 older people could be experiencing abuse in Wales, and that equates to 170,000 older people. But we know we have nowhere near that amount of people reporting abuse, whether that's to the police, to social services, or to organisations that work with older people or who work in domestic abuse. More worryingly, 1 in 5 people in Wales don't know what to do if they suspect abuse is taking place. There is such a lack of understanding about what abuse is, and Louisa went through the different types of abuse. But we don't think about those things happening to older people. What can happen to a younger person can happen to an older person. That's being punched, that's being raped, that's having your money stolen, that's being coercively controlled. All of that can happen. Abuse is not just between intimate partners, and it can be partners that have been that are new partners or people who've been in abusive relationships for decades. And also we know that family members are perpetrators, and in fact more than a third of callers to our helpline reported that the perpetrators were family members with sons and daughters. And we know that abuse happens to every older person, male and female, and in fact nearly a quarter of our victims are men, and we know that it's underreported. And I wanted to talk about why it's underreported. It's really good to know that Gwent is being so proactive, and the to report and not to report guide is there. But we need to know that the abuse is happening, and the barriers that older people face are huge. They can involve shame, particularly with older men, that shame and embarrassment that the abuse is taking place to them, the feelings of becoming vulnerable in older age when previously they weren't. People telling us that they've never ever been a victim and now they're an older person, they are, and that feeling of shame that comes with that when there shouldn't be any. And a lot of that is about the lack of awareness that we all have about how people can become victims of abuse. And then the fear of repercussions, the fear that if they tell someone about the abuse, that a loved one will be visited by the police or be taken away. So many older people don't want their abuser, their family member, to go to prison. They just want the abuse to stop. And there's the fear of repercussions, the fear that they may be reliant on their perpetrator for care. And just that sense of hopelessness that older people, sorry, I do apologise. Just that sense of hopelessness that older people have, that they won't be believed, that abuse isn't recognised. And we know that so much of particularly abuse that takes place in families is not seen as abuse. We had nearly a third of older people, a third of respondents in Wales tell us that they didn't think domestic abuse or violence directed towards an older person constituted abuse. There's a lack of understanding, and all this feeds into people's worries about reporting what is happening to them. There's also concerns about the unwanted intervention, about being taken into home, about receiving social services support and the stigma that comes with that. We know also that older people don't know where to go. The Commissioner's report, the Older People's Commissioner for Wales report that was launched today, directly talks about the lack of services, specific services for older people experiencing abuse, whether that's services within the community, working one-to-one with people with specialist knowledge, or whether that's with people who there are no refuge spaces available, so that once someone does report, there isn't anywhere for them to go. So there is a lack of knowledge about what support is available, and often that's because abuse services don't advertise their services towards older people. Even simple things like the imagery that is used often doesn't have older faces, doesn't have male faces, all leading to people feeling shameful, scared, hopeless, concerned, and not knowing where to turn. So Hourglass, we provide general and specific information and guidance. We provide signposting to appropriate agencies, but we need to know that they're there. So you need to tell us. The Older People's Commissioner for Wales has created a support service directory, and please make sure that all your organisations are on there. As well as Hourglass, we have our own knowledge bank where we would like all the information that you can give us, so that we can ensure that anybody contacting us knows where to go for support, because we provide information and advice and we signpost. And we're there not just for older people, we're there for anyone concerned about an older person. And we have resources, so we have resources on every type of abuse aimed directly, specifically for older people and those concerned about them. And please do get in touch. We're here, we can provide support, and we would love to link up with anybody who is as committed as you all are to stop the abuse of older people and promote safer ageing. Thank you.
Thank you, Rachel. Really important to highlight in particular that really visible and important aspect of abuse affecting older people, but older men and older women. So thank you very much, and we'll make sure that from a practical perspective that we include all of our support services across Gwent on your website and in your contact details. Can I hand us over now to Andrea Nicholas-Jones, who works for Action for Elders and provides support for older people, to talk to us about what's happening locally. Andrea, if I can hand over to you, please.
I'm hopefully going to be ably assisted by Rhian, because I am an absolute Luddite. So I'll apologise in advance. I am one of those older people who's technically excluded. So Rhian is going to run my presentation for me. I don't want to rehearse all the really useful information we've had from the previous two speakers, so I will just focus on one part of the report that we've produced for your regional board. So what you've got on screen at the moment is just an overview of the project that we were invited to undertake. And we weren't just looking at barriers to access to abuse services for older people. We were also looking at other individuals from different protected characteristics, also whom were likely to experience barriers or likely to have issues in terms of accessing traditional violence against women and domestic abuse, sexual violence services. So next slide, please. So I'm just going to kick around the definitions, because I think it's really important that we do understand that we've had a definition of what we mean by elder abuse since 1993, and it was actually Hourglass, as is now, that published the first definition of what was considered to be elder abuse. And that was actually adopted by the World Health Organization. It's actually really important that we make that distinction between what we traditionally think of in terms of domestic abuse and violence, and actually focus that in on the older individual and what it means for them. And the next slide, please. And again, building on what's been said, particularly by Rachel, is as you start looking at the older age groups, we start to see a real increase in the incidence of male victims. And for male victims, it is particularly challenging to even recognise that they are potentially victims of abuse. And if they recognise it, the challenge in them coming forward and seeking support is, it feels insurmountable to many of them. When we surveyed older people as part of our research, direct comments we got from older men is it's embarrassing, they're ashamed, they would never think of themselves as being a victim, and it challenges everything about their identity as a man in their family, the fact that they are now becoming a victim of abuse, whether it's an intimate partner or a child or a grandchild that's instigating the abuse. And Dewey's Choice actually found out when they looked at who the perpetrators were, 50% of perpetrators approximately were just family members, and only about 50% intimate partners. And that again is quite different from when you look at, again, traditional stereotypes of who the victims of domestic abuse are. But pulling on Hourglass polling data, because that's the most recent and I think most useful piece of data that we have at the moment around incidents of abuse in older people, the majority of people in the community think that there's a very small number of perpetrators who are intimate partners, and almost a small number of children who are perpetrators. And there's a real strength of feeling that older people are much more vulnerable to abuse in the formal care relationship rather than in their own homes, in familial relationships. So 16.5% of people thinking that abuse would be carried out by care home staff, 12.5% by carers in the community in the older person's home, and 22% by strangers. That really is a real skew on what we know is the reality of who perpetrates abuse against older people. Can I have the next slide, please? And again, in this generation, abuse wasn't something that people talked about. When pressed, people would say, oh, well, we knew that maybe Mr. Jones was hitting Mrs. Jones, but, you know, he was a good provider and they never went without. People talked about being smacked by their parents, the fact that they'd witnessed their father hitting their mother, but those weren't things that were constituted or thought about as abuse in that generation. So again, as a generational barrier, people in our older generations have got incredibly high tolerance levels of what they will accept as being behaviour that is something that is not necessarily natural, but it's something that happens, and it's something you don't talk about, and it's something you live through. So there's a massive, massive reluctance to identify themselves as either victims or acknowledge the real trauma that's being inflicted on them. Have the next slide, please. So again, we see this shift in the research base going back as far as 2009. When we look at under 65 age group, 9 out of 10 victims are female. But when we go over 65, 2 out of 5 victims are male. And there is increasing evidence that as we go over 75 and 85, that the incidence in terms of male victims starts to increase quite significantly. Unfortunately, as the British Crime Survey only takes us to 64, we don't have national comparable data that we can look at in terms of who the victims are. But by looking at the organisations that are providing support to people, we can start to get a picture of how many male victims we now have in this particular area. Next slide, please. It's been mentioned previously about relationships where there's a dementia, this can be a real issue. You can almost end up with dual perpetration, where you've got an individual who might be being subjected to violence by somebody who has a dementia, but then we're also seeing coercive control in terms of how that individual is being managed. So it's a really, really difficult scenario for existing and traditional statutory services to get their head around. You can be looking at situations where you've got two perpetrators and two victims, and that is something that's incredibly difficult to unpack in the context of the services that we have at the moment. Next slide, please. Rachel started talking about the barriers, and again, I want to reinforce this point. One of the first things we need to do if we're going to actually start seriously talking about improving services for older people is to have a publicity campaign, a media campaign that actually helps older people themselves recognise what constitutes abuse. Because if you don't know what abuse is, how can you ever hope to identify yourself as a victim? And if you don't identify yourself as a victim, you're not going to seek support. So we do need to think very seriously about how we get older people to recognise that the behaviour that they're living through, what their life is at the moment, isn't the life that they have to continue living. That there is hope, there are solutions, and that actually the way that they're being treated is abuse. There's a real lack of specialist services. Again, the previous two speakers have talked about the services that are currently available, but when you're talking about an older person, then being told if they disclose that they're being abused, that they're going to have to move into a hostel, or they're going to have to move into temporary accommodation of some description, that's not something that's going to motivate them to leave the situation. They could be leaving the home that they've lived in for the last 60, 70 years, the home that they own, the home that they've invested their entire lives in. It's very, very difficult for an older person to think about having identified themselves as being a victim, seeking support, and then basically be told that as the victim, you're being punished because you're being removed from your home. We have to start thinking very seriously about what specialist services we can put in place that can support victims whilst enabling them to retain their lives. We have to start having those serious conversations about why is it always the victim that moves? Why don't we have appropriate services in place that can remove the perpetrators, that can work with the perpetrators to get them out of the family home and enable the victim to continue with their lives safely in their home? There's a real lack of appropriate accommodation. Very few refuges have got accessible accommodation that's suitable for disabled people or older people, and again that's a huge issue, apart from the real barrier that there would be for an older person in leaving their home and moving into some sort of refuge accommodation. If you haven't got accommodation that looks and feels suitable, then again the individual is not going to consider that as an option. They'll likely stay in the home, in the environment, continuing to receive the abuse because it seems like a better option. After all, if you've lived with it for the last 40 to 50 years, what's another 10? And we've got, again, a lack of specialist staff. Older people don't disclose abuse in a 5-minute conversation over a helpline if they haven't already gone along a massive journey to get to that point. What we need to have in place if older people are going to feel comfortable and feel able and safe to disclose what's happening to them, there needs to be a relationship. Short-term interventions don't work with older people. You can't just have 3 counselling sessions and then that's okay, now you get on with your life. It would have taken them potentially a lifetime to get to the point of disclosure. They're going to need the rest of the lifetime to be supported to get through the trauma that they have lived through. They really do need to have services that they know they can rely on and build a relationship with for the long term, not just the short term. And once we start talking about intersectionality, then the problem becomes almost unimaginable. Because if you're an older person who is LGBTQI, you might actually be outing yourself as you're disclosing your abuse. Your family may not be aware of an intimate relationship. The community may not be aware of the relationship that you're in. So you are exposing yourself at the point of disclosure to stigma that you've possibly spent your entire life avoiding. If you're a member of the Black, Asian and minority ethnic community, again, services don't look like they belong to you. They don't look like there's something that you can approach. You can't recognise yourself in any of the services, the staff, the publicity materials, the helplines. None of it actually speaks to you as a member of that community and says, this is something I could approach and this is something that I could use. And again, disabled people, the imagery, the way in which services are promoted, the way in which services are managed. There are huge issues around how services will be perceived. There's a real risk as well, the fact that we all too quickly move, if it's a disabled person or an older person, we move into safeguarding. We step away from domestic abuse and sexual violence services and we move immediately into safeguarding. And that's not always the right way for that person to be dealt with, because again, it almost becomes like a victimless crime then. And next slide, please. So, recommendations. I think it's going to be absolutely critical that you put in place a specific project to look at older people and what they want and what they need, and use co-production, because older people are the experts in their own lives. They know what will help, what will support them, what will encourage them to be able to disclose. You need to look at having an information and education programme, not just for staff and for services, but actually for older people living in the community, so they themselves can recognise when they are victims or they can recognise perpetrators. And you really do need to think about having specialist services and specialist staff who are able to provide the appropriate support at the appropriate time in the appropriate place for older people to be able to access. And thank you. And apologies, I probably talked too much because it's a subject you might have gathered I'm very passionate about. Thank you.
Thank you, Andrea. That's really provided us with important context, and really thank you for sharing your important report and statistics with us. I'm going to hand over very quickly and promptly to Detective Inspector Steph Blakemore to give us, Steph, hopefully an input from yourself.
Good afternoon, everybody. Can I just check if I shared my screen?
You have, yeah.
Wonderful. That's the first hurdle. So afternoon, everybody. As Ilaria said, my name's Steph Blakemore. I'm a Chief Inspector in Gwent Police, and my responsibility at the moment is a serious organised crime coordinator. But I became involved in what was called the protection of vulnerable adults some years ago, and I had the privilege of being a detective sergeant on what was then a protection of vulnerable adults team. And that allowed me to develop amazing relationships with a range of professionals to look at effective safeguarding tools for vulnerable people, which include our elderly community. So I'm going to move on to my presentation. Just a little introduction as to who I am.
Steph, I don't want to put you under any pressure, but we're really tight for time, so hopefully help you through.
Yeah, does it?
Yeah,
I go on to the next screen.
Yeah,
wonderful.
Ah.
Okay, so first of all, I want to look at what are the risks. So we look at the criminogenic factors, and these could be physical signs that an elderly person lives at an address. Whilst these things keep elderly people safe living in the community, they also pose as an attraction to our offending community, that someone vulnerable lives at that property, and they could be a keypad on the outside of the address, handrails, and of course they will allow our elderly community to enter and leave their home address safely, and also allow for carers to come into the property safely. Unfortunately, they do present as an attraction for offenders. Our elderly community are also at risk of scams. Whilst traditional techniques are still being used to prey on elderly people, there's been an increase in cyber scams. And this has been more and more recurring during the pandemic because of increased isolation, where Families have rightly so wanted to keep their loved ones safe. It has left our elderly community very lonely, and whilst we encourage our elderly community to be digitally aware and inclusive, they've gone online and started to find themselves being groomed by offenders, and there's been an increase in where our elderly community have in fact parted with money, where these fraudsters have been able to groom and use very, very crafty techniques in being able to offend against our elderly community. An increase in exploitation we also refer to as cocooing, where organised criminals are using addresses to continue to conduct as well their substance misuse and even sexual exploitation. It may not be using the person who lives at the address, but they will take over that address so they can continue with their criminal activity. And this could be where they're bringing young people into the address to use through child criminal exploitation or child sexual exploitation, and then putting the vulnerable person under immense pressure to allow that activity to take place. They're also at risk of physical harm, and as has been mentioned in other fantastic presentations today, people who our elderly community are more at risk of dementia diagnosis, and with that, one of the very significant behaviours that does take place is that people will wander and then they're reported missing, and what that then results in is potential exposure to elements. We've had beautiful weather over the last couple of days, and they could be resulting in them being dehydrated or missed medication and becoming disorientated. Unfortunately, with the diagnosis of dementia, people will walk in a straight line, and this may mean that they don't see potential hazards, and this could be that they walk across a road or a train line and putting themselves at further physical harm. And there also comes then difficult decisions for families accepting the transition into a care home or a nursing home. And more families are trying to support their loved ones whilst living at their home address to give them more independence. But then what that in turn could result in is them being at risk of harm. So we've achieved lots in Gwent Police, and this has started with the Herbert Protocol, and I hope professionals involved in the webinar today are aware of the Herbert Protocol. If they're not, this gives me an opportunity to talk about something I'm really passionate about. So the Herbert Protocol was created following a missing incident which involved a war veteran, George Herbert, and he lived with dementia on the southeast coast of England. And in its simplest form, it's a safeguarding tool which is designed to provide effective search parameters in the unfortunate event a person who lives with dementia is reported missing. The family of someone who lives with dementia just collates pertinent information which they can then pass on to the police, and then it's stored in the unfortunate event that that person is reported missing and does go wandering. It's information such as where they lived during a certain time in their life, where they worked, what places they like to visit, because it could be that that person has tried to find their way to that location, and which, as I said, they may walk in a straight line there, which puts them in risk of further harm. So I led the pilot along with fantastic partners in 2016, and we continue to push the project, and we now have over 250 people living across our communities in Gwent who live with dementia or are safeguarded by the scheme. If any of you are interested, the forms are found on our Force intranet site, or you can email our crime prevention team or myself, and I'll give you my email details at the end. So I'm not happy just to rest with the Herbert Protocol. We need to move with the times, and I'm really excited to tell you all today about the next scheme that we're going to introduce in Gwent, and this is the dementia wristband scheme. And again, this is another effective safeguarding tool. I'm not the best with technology, but it uses near field communication technology. and I have one here. It's very similar to those of you who wear like a sports watch, which monitors, you know, your heart rate and things like that. But with this wristband, it contains information about the wearer, their name, not their address, but then a telephone number of a carer or a loved one who should be contacted in the unfortunate event that they do go missing. Yesterday, my daughter, she's got a little job for the summer, works in a local pub, and a man with dementia walked into the pub really confused, couldn't tell her where he lived or a name. Had he been wearing one of them, Eva could have got her phone. You just put it over the wristband such as that, and it'll come up with the details of the carer who needs to be contacted. So I'm working with partners. We've developed a task and finish group. The project plan has been drafted and sent to the Older Persons Commissioner, and they've agreed for Gwent to be the pilot as the format for the national rollout. Even in Somerset, colleagues have implemented it in their force area. So I'm in close contact with them to just make sure that any learning that has come from their pilot, we can sort of learn from wherever gaps there were and make sure that we can have an effective rollout here in Gwent. So apologies for being a bit rushed, but I know there's still more people to present. There's my details with my email, and I'll also pop it in the chat as well. So any questions regarding the Herbert protocol and the new dementia wristband scheme, please contact me and I'll be really happy to pass on any pertinent information to you.
Thank you, Steph. Really appreciated, and sorry for rushing you along because I know that there is so much you would want to share. Can I hand us over to Nicola Fitzpatrick from Llamau as our last speaker before the Chief Constable?
Oh. Apologies, mine's just loading. So I'm going to try and wrap this up in a couple of minutes. And hopefully the slides will then follow. I have no idea how to change the view, so you're going to have to bear with me because I'm just pushed for time. But I just wanted to highlight a really pertinent stat when it comes to older people and bow dress fee. That is 25% of all domestic homicide reviews are of people aged 60 plus. And up until 3 years ago, as was said previously, these would have been hidden on the crime data stats because the ONS didn't count. It only counted up to age 59 up until then. So it's a lot more hidden than it ever has been up until recently. 50% of sexual violence happens within the victim's own home, and 20% of sexual violence happens in residential settings. And I think that's really important elements to highlight when we're talking about safeguarding of adults. I'm not going to speak about themes across the sector because all the previous guests are, but I am going to end this today with what we're actually doing in Gwent to raise awareness and highlight that older people are on our radar, as has been said previously, but how important it is that we do get that messaging out there. So within Gwent, working with the PCC's office, with Gwent Police, with Health, we have run, especially through the pandemic, a really targeted campaign of awareness raising and information sharing by targeting GP surgeries, pharmacists, vaccination sites, COVID test centres, in order to make sure that the places that older people frequent, we are visible as services, and we are showing that services are still open and still available to them. We have completed a huge awareness raising campaign using imagery of older people specifically to highlight that, to try and make presence more visible. And we are rolling out the IRIS programme within Gwent, which is a targeted training provision for GP practices to make sure that they are aware of how to ask the questions, what might be the warning signs as been discussed in previous sessions, and to ask questions behind the presentation. So if somebody's presenting with minor injuries or low-tier mental health issues, unable to sleep, depression, changing circumstances, then that is being highlighted. We have seen as a sector, as has been highlighted also, an increase in older people being abused within their own homes from adult children. So that is something that we are actively working with as a sector. And we are also training up some of our staff to be specialist older people's IDVAs across Gwent. So I wanted to leave you with that picture of what we're doing moving forward for older people and working across the sector, across different organisations to make sure that we're working further to ensure that older people can access our services. These are the organisations that work across Gwent with victims of ODRSV, and I'm not going to whistle stop talk because I'm going to hand you back. But the contact details for all of them will be available as these slides go out. Thanks very much.
Thank you, Nicola. Thank you so much for really focusing your presentation, but most importantly for all the practical support work you are doing for supporting older people in our communities. So can I hand us over now to our Chief Constable, Pam Kelly, for some concluding remarks and to finish and conclude our session. Chief Constable.
Thank you, Aleri, and thank you everyone for the very insightful presentations today. It's surprising what you can cover in an hour, isn't it, in terms of detail and also practical help for everyone. I think we should be very proud of what we do here in Wales, and I'm particularly proud of what we do in partnership here in Gwent as well. And a sincere thank you to the Police and Crime Commissioner's Office for pulling this event together. It doesn't just highlight some of the great work that we're doing, I think it helps us network around this really important area. And just from a Gwent Police perspective, I want to make sure that we're very clear in terms of what our commitment is to elderly people, and in particular, the vulnerable elderly people. And I read a quote earlier this week that I wrote down, mindful of today, and that was, to forget the elderly is to ignore the wisdom of years. We often think about future generations, and I think it is important to think about young people and future generations without question. But actually, we owe an awful lot to the generation that's just been before us, and to provide that wisdom and have given us so many opportunities. And in any healthy, forward-thinking, respectful society, elderly people are revered because of that wisdom. So as partners here in Gwent, we absolutely need to make sure that we report incidents of concern, that we collect intelligence, and that we become innovative in terms of how we protect vulnerable elderly people now and in the future. And I'm particularly pleased that here in Gwent we are going to be piloting the dementia wristband, because we so often see people vulnerable, disorientated in our communities, and we owe them the duty of care and respect that they deserve. So diolch yn fawr iawn I chi gyd for your commitment, for your ongoing commitment, your ongoing partnership work. But let's remember that one person caring about another represents life's greatest value. And when that involves vulnerable people, that is hugely, hugely important. Thank you for your time today, and thank you, Commissioner, for arranging the event.
Thank you, Chief. Thank you, Chief Constable, and thank you everyone for your contributions and everyone for your attendance today. We will be circulating the slides and the links to the YouTube for everyone to be able to see the full information for the session. So thank you to everyone.
Thank you.
Thank you.
Thanks, everyone. There will
you.
be a survey coming out. I'll be sending in via email. So it was in the chat box, but if you've got some time, just do that as well. Thanks so much for everybody coming.
Thank you. Bye.
Bye.
Thank you, Nicola.